This tutorial explains how the cost assessment tool, known as the Rapid Assessment Protocol, or RAP, is used to estimate the costs of implementing social protection provisions. In this video, we first describe the framework of the RAP, and then explain the steps involved in using the RAP in a real-life situation. For this example, we will refer to the case study of Croatia. The RAP model consists of three parts, denoted by blue, green, and red. Blue represents the input data. Input data contains statistical information about the population of the country, its labor force, economic situation, government revenues, and expenditures. This data needs to be collected by the user and entered into the RAP model before the cost of various social protection floor benefits can be calculated. Green represents the cost of implementing social protection benefits. The cost is expressed in the absolute currency value, as a percentage of the country's GDP and its government's expenditure. Expressing it as a percentage of GDP or government expenditure helps to give a better idea of the cost. Red represents the cost of a package of the combined benefits. Now, let's take a closer look at each section. The blue data input section consists of 5 main spreadsheets. POP stands for population, is the total number of people in the country, including different age groups and genders. LPR, or labor force participation rates, also known as AR, or activity rates, is the proportion of the population that participates in the labor market. It's also broken down into age and gender. EAP, or economically active population, is the number of people in the country who are part of the labor force. The data in EAP is obtained by multiplying the data in the POP and AR worksheets. ECO, or macroeconomic framework, contains economic indicators about the country, such as inflation, minimum wage, unemployment rate, poverty line, GDP, and other indicators. GGO, or General Government Operations, tells us the central government revenue and expenditure, and the difference between them, or the balance. Once we have all the input data, we are able to project the cost of benefits. The second part of the RAP model, denoted by green, is used to calculate the cost of different scenarios under the SPF guarantees. There is one benefits spreadsheet per guarantee. The first green spreadsheet may represent healthcare benefits. The second may represent benefits for children, a third for working age, and a fourth for the elderly. Furthermore, we can have additional spreadsheets for maternity, HIV, and other benefits. Once we know the cost of different scenarios, we can then move on to the last part, in red. This red part of RAP is a summary of the cost of implementing all the scenarios, as well as the cost of low and high scenarios for a combined package of benefits. Next, let's look at the formula used in the benefits spreadsheet. The cost of implementing a scenario is calculated as the cost of benefits per head multiplied by the number of people and coverage of the target group, plus the administrative cost. We can understand the RAP better by looking at a scenario from Croatia. A possible scenario is to extend the Public Health Care Plan, PHCP, to uncovered poor people in the country. In order to determine the number of poor people in the thousands in the year 2011, we multiply the total population by the national poverty rate in the ECO sheet. This is dragged till 2020. To find out the number of poor people covered by PHCP, we refer to the case study on health section on assumptions. It states within the case study that PHCP covers 48% of the poor population. We drag this to project the number until 2020. The number of poor people not covered by PHCP is the total poor people minus the covered poor people. Our target group for the scenario is the number of poor people uncovered from PHCP benefits. The take-up rate is written as 0% until the current year, 2013. We can assume the government will start implementing the scheme in 2014, and the take-up is 25%. This increases to 50% in 2015, 75% in 2016, and full coverage or 100% from 2017 onwards. Thus, the target group covered by the scenario is the total target population multiplied by the take-up rate in each year. Now, let's look at how to determine the benefit cost. The assumptions in the case study has the annual cost of PHCP benefits per person as 2,500 Parisian dines in 2011. To project the benefit cost for 2012, we multiply the cost in 2011, for example, 2,500, by the average wage increase in 2012 from the ECO sheet. This is done because healthcare expenses are normally assumed to increase in proportion to wages. This is dragged until 2020. The total cost of benefits per year is the target group of the scenario multiplied by the per head benefit cost. It is divided by 1,000 so that we have the cost in million Parisian dines. The case study states the admin cost as 15% for targeted programs. As this scenario is targeted at poor people, we can take 15%. The total cost of implementing the scenario is the addition of the total benefit cost and the total admin cost. It is projected by dragging the cells until 2020. Once we have the total cost in Parisian dines, we can find the total cost as a percentage of national GDP or as a percentage of government expenditure. To find out the total cost as a percentage of GDP in 2011, we divide the total cost of the scenario by the GDP at current price from the ECO sheet. The cost is given in million dines, while the GDP is expressed in billion dines. So we multiply the GDP by 1,000. The total cost as a percentage of government expenditure in 2011 is calculated by dividing the total cost of the scenario by the central government expenditure from the GGO SQ sheet. Multiply the central government expenditure by 1,000 so that both numerator and denominator are in million dines. In this way, we can find out the cost of a scenario in dines and express it as a percentage of GDP and government expenditure. In the summary sheet, for each of the 6 guarantees, we list the scenario and its cost of implementation as a percentage of GDP from 2013 to 2020. Starting with healthcare, Scenario 1, Scenario 2, and 3, we then repeat the exercise for children, working age, elderly, maternity, and HIV. Once this is done, we list the low and high scenarios for each guarantee. For healthcare, the low scenario is assumed as Scenario 1. For example, extending PHCP benefits to all uncovered poor people in Croatia. The high scenario is Scenario 2, extending PHCP benefits to all informal economy people in Croatia. Similarly, we list the low and high scenarios for all the other guarantees. The total low scenario is the addition of all the individual low scenarios, while the total high scenario is the summation of all the individual high scenarios. To give a graphical representation of the cost of scenarios as a percentage of GDP, we can create a chart. Finally, we complete the GGO sheet, which gives the central government expenditure, assuming that the scenarios are implemented in the near future. We can calculate the budget surplus or deficit when the total low scenario or the total high scenario is implemented. To calculate the balance as a percentage of GDP when the total low scenario is implemented, we subtract the cost of the total low scenario from the balance at status quo. Likewise, we subtract the cost of the total high scenario from the balance at status quo. This gives us the balance as a percentage of GDP, assuming that the total high scenario is implemented. This data can be represented as a graphical chart for better understanding. This concludes the tutorial on the Rapid Assessment Protocol.